What is stroke? Reasons, signs, treatment, precautions, and tests required to identify stroke. A stroke is a medical emergency that occurs when the blood supply to part of the brain is interrupted, causing brain cells to begin dying due to a lack of oxygen and nutrients. Strokes are classified as either ischemic, caused by a blood clot blocking an artery, or hemorrhagic, caused by a burst blood vessel. Prompt treatment is crucial for minimizing brain damage and improving recovery. 1. Causes of stroke. Ischemic stroke, most common type. About 87% of cases blood clots, often form due to atherosclerosis, hardening of arteries, or can travel from other parts of the body. Atherosclerosis, plaque buildup in arteries can reduce or block blood flow. Heart disorders, conditions like atrial fibrillation can increase the risk of clot formation. Hemorrhagic stroke, high blood pressure, chronic hypertension can weaken blood vessel walls, making them prone to rupture. Aneurysm, a weakened area of a blood vessel that bulges and can burst. Trauma, head injuries or blood vessel abnormalities, blood thinners, medications like anticoagulants can sometimes lead to bleeding. Transient ischemic attack, TIA, often called a mini-stroke. A TIA is a temporary blockage of blood flow to the brain and serves as a warning sign for future strokes. 2. Signs and symptoms of stroke. Fast symptoms are commonly used to identify stroke signs. Face drooping. One side of the face may droop or feel numb. Arm weakness. Sudden weakness or numbness in one arm. Speech difficulty. Slurred speech or difficulty speaking or understanding. Time to call emergency services. Immediate action is critical. Other symptoms. Sudden trouble seeing in one or both eyes. Sudden severe headache with no known cause. Dizziness, loss of balance, or difficulty walking. Confusion, memory loss, or altered consciousness. 3. Treatment of stroke. Ischemic stroke. Thrombolytic therapy. Clot-busting drugs like tissue plasminogen activator, TPA, given within 3 to 4.5 hours of symptom onset can restore blood flow. Mechanical thrombectomy, a procedure to remove large clots for patients with major blockages. Medications, antiplatelets, e.g. aspirin, or anticoagulants to prevent new clots. Hemorrhagic stroke, surgery, to relieve pressure or repair blood vessels. Medications, blood pressure lowering drugs to prevent further bleeding. Post-stroke rehabilitation, physical therapy, speech therapy, occupational therapy, and support for mental health may be necessary for recovery. 4. Precautions against stroke. Control blood pressure. High blood pressure is the most significant risk factor for stroke. Regular monitoring and medication adherence are key. Healthy lifestyle choices. Eat a balanced diet low in saturated fats and salt. Exercise regularly and maintain a healthy weight. Quit smoking. Smoking doubles the risk of stroke. Limit alcohol consumption. Excessive drinking can raise blood pressure. Manage diabetes and cholesterol. Proper management through diet, exercise, and medication if necessary. Regular health screenings. Monitor for risk factors like high blood pressure, high cholesterol, and heart conditions. 5. Tests to diagnose stroke. Brain imaging, CT scan, helps detect the type of stroke, ischemic versus hemorrhagic, and guides treatment. MRI provides detailed images of the brain to assess damage and locate affected areas. Blood tests, to check for glucose levels, clotting time, and possible underlying infections. Electrocardiogram, ECG checks for heart issues like atrial fibrillation, which increases stroke risk. Carotid ultrasound, evaluates blood flow through the carotid arteries to detect blockages or narrowing. Echocardiogram, assesses heart structure and function to identify sources of clots. Angiography, imaging to view blood flow in cerebral arteries, especially for assessing an aneurysm or other abnormalities. Early recognition of stroke symptoms, emergency treatment, and ongoing risk management are essential for preventing and reducing the impact of strokes.
Thank you for watching. Please like, subscribe and share our channel, The Amused Notebook.